Meningitis, as you can tell from the name, is inflammation of the meninges. Do you remember what the meninges was? It's the lining of the brain. So you can see in this picture, you have the brain and you have the blue stuff around it. That's the meninges. Remember, it has multiple layers. Do you remember what the layers were? The layers were the dura, the arachnoid, and the pia. And so you can get inflammation of this meninges due to infection, and that's infection by bacteria or viruses or fungi. And so now, let's say you have infection of your meninges. What symptoms can you expect? You're going to have headache because you got that infection inside your head. You got fever, it's infection. And you can have neck stiffness because this meninges is not just limited to the brain. As you can see, this blue goes all the way down. Goes down. It also lines the spinal cord and goes down the neck. So when that irritation of the meninges around the neck happens, then you can get neck stiffness. So that's a very important triad that you never want to forget. And you don't want to miss this meningitis diagnosis. The other symptom that you can have is vomiting and altered mental status. And that's due to increased intracranial pressure. Because the same idea as always, you have inflammation, you're going to get edema, you're going to have fluid that's going to leak out of your vessels because they're more permeable now because it's inflammation. So now you're going to have extra fluid in your head. And remember, your skull is a fixed volume. So when you have all this extra fluid and a fixed volume skull, there's going to be increased pressure. And that pressure is going to cause this vomiting and altered mental status. The way you diagnose this is with a lumbar puncture. And that lumbar puncture, which basically means a needle into the lumbar spine, and the point is to get CSF fluid for analysis. So we see in this picture here, we poke a needle through, poke it into the spinal canal, and the reason why you do it in the lumbar spine is you can see that this spinal cord ends around L2. So you want to do your lumbar puncture at L3 to L5, and the mnemonic is you do L3 to L5 to keep the spinal cord alive. So you're not poking the spinal cord, you're just getting that fluid around this these extra nerve endings from the spinal cord. I think that's called the conus medullaris or the cauda equina. So not as relevant, but anyways, your fluid findings are going to tell you if it's bacterial, virus, or meningitis or fungal etiologies. And what you look at is you're going to look at glucose, you're going to look at the white blood cells, if it's neutrophils or lymphocytes, and you're going to look at the protein. Now, a couple things. Bacteria and fungi like to eat glucose. They love sugar. So they're going to eat up all that glucose because we have bacteria or whatever infecting organism inside the brain and inside eating up all that CSF. So your glucose goes down for those. And so the key thing is that in viruses, your glucose is normal. Now you have infection, so we're going to have white blood cells come in to take care of the infection. And the key thing is that for bacteria, you see increased neutrophils. And then for viruses and fungi, you see increased lymphocytes. And that's how it always goes. So remember, bacteria always goes along with neutrophils, and then viruses and fungi have increased lymphocytes. Finally, for protein, pretty much all of them are increased. Remember that inflammation causes that increased permeability to protein. So you're going to get increased protein for all of them. The one difference is that viral meningitis has maybe slightly elevated protein. It's not. Sometimes it might be even normal. So the way we treat this now is we give them empiric antibiotics. Once we get that lumbar puncture diagnosis of meningitis, we're going to treat them. You hit them with ceftriaxone, so you don't have to figure out which bacteria it is or which whatever. You hit them with ceftriaxone, you hit them with vancomycin for broad coverage. And you can add ampicillin if you suspect the patient has listeria. And the reasons why you would suspect listeria is you have a very young patient, so an infant, or you have a very old patient, or they're immunocompromised. So you have either spectrum, the age range, or you have immunocompromised patient, then they're at risk for listeria, and you got to add ampicillin to cover that. Now, complications here. The most scary one is cerebral edema. We just talked about how there's increased intracranial pressure, and that edema is going to cause pressure on the brain, and you can lead to brain herniation. That means the brain is going to get pushed through this small little hole, and stuff is going to herniate. And you're going to compress different structures on the brain, and you can cause death. And we've talked about brain herniation already. The other and the most common complication is hearing loss. And that can be due to multiple things. It can be due to direct bacterial invasion, messing up your cranial nerve 8. It can be due to an inflammatory response to infection. And you can have damage to cranial nerve 8. You can have damage to the cochlea or the labyrinths, which we're going to talk about in a second. So that's it for meningitis. So CSF findings are key. So knowing this triad is key. So remember, this will also present with headache, just like the headache stuff that we just talked about. We're going to see all these associated symptoms. All right, so that's it for meningitis.